Since last spring, it's been one dark chapter after another. Pandemic-related illness, death, job loss, even poverty. And for some families, there's another source of pain, often less visible than the rest: child abuse.
We saw a case not long ago, just before the holidays, of a 4-year-old boy whose jaw had been broken in 3 places.
Russell Mark is president and CEO of Juliette's House, a child advocacy center in McMinnville. He says during the pandemic, many children facing abuse haven't had help from in-person teachers or church staff who are trained to notice signs of abuse and required to report them.
We're very concerned because our referral numbers are actually down in Yamhill County. But what we're seeing is more severe and more complex cases.
Something must be done.
Mel Anthony Phillips is co-executive director of OASIS, Oregon Abuse Advocates and Survivors in Service. He says another unusual pattern he's seeing is more children calling to report their own abuse.
There should be so much more protection and intervention and things happening before that report should even be made by that person, if ever by that person. So what COVID has really showed us is where the system really fails.
Data tracked by the Oregon Department of Human Services reflect what many nonprofits are seeing on the ground. From April through December 2020, call volume to the Oregon Child Abuse Hotline was down by about 30% compared to the same period in 2019. But the number of assigned cases has remained similar year to year. That leaves some to surmise that more abuse is happening. It's just not being reported.
The truth is that we are unable to conclusively say what the impact of the pandemic has had on rates of child abuse.
Kristen Komnahawk is district manager of the DHS Oregon Child Abuse Hotline. She says something else the data doesn't account for is the number of people who've been calling the hotline as a resource to help families in need.
What we are looking closely at are the types of reports of abuse that are being called in on are really about families struggling with poverty and families that are really needing resources and services, not necessarily a child welfare intervention.
To that end, children's advocates say the numbers shouldn't dictate the community's response.
What should dictate our response is how, first, the humanity of the people involved should be our top priority.
State Representative Anna Williams chairs the House Committee on Human Services and Housing. She's championing 3 bills aimed at funding child abuse prevention and intervention through child advocacy centers.
Our job right now as we navigate these crises is to care for your neighbor, to look around at who's suffering and think about what you have that you can offer to them that can be of support. It could be a listening ear. It could be a bag of groceries.
In cases that do involve abuse, experts say neighbors are now children's first line of defense. It's important to pay attention to those who live in your area. Watch out for unusual bruising, drastic mood changes, and ask questions like, do you feel safe at home? Also, it's okay to talk with other neighbors before taking action.
We need to, instead of stepping back, we need to step into each other, really lean into family and community like we haven't before.
If you think that there's really something seriously wrong, then make that phone call.
Whether it's calling the child abuse hotline or police to request a wellness check, experts say it could change how a child's story ends.
You never know if there's a portfolio already developed on this family, and that's that one piece of evidence that says there's something going wrong.
Catherine Cook, KGW News.